department. The cost of signage, I've been assured, is going to be phased in as needed, not in the transition of the name over the period of time as the signs need to be replaced, not at one time, is my understanding. Is that correct?
Yes, ma'am, and as things are, like, documents are reprinted and so forth, you can
So it
change.
would be done in the most cost-effective manner.
Yes, ma'am.
Thank you.
Councilman Christie?
This seems to be a small change, but in the propensity of moving a disease care system to a health care system, this makes sense. And talking with the director in the department, moving it to the Houston Health Department, it's the propensity towards keeping people healthy instead of a disease care system. This is good.
Councilmember Bradford?
I don't know how changing the label has that much of a direct impact on being good in the way of services. I understand that there's maybe an indirect nexus, but it's 50,000. Councilmember started, whether it's over a time period or at one time, it's $50,000 out of the general fund and $3,000 to design is my understanding. So that's $50,000. And what I'm sitting there thinking about is I started last year informally and this year very formally pushing for an officer residency incentive program. So we have to get back to core services. $50,000, that could be 5 Houston police officers living inside the city of Houston. That's what that could be. Under my proposal, $10,000 per officer. This could be 5 officers implementing that much needed program that all citizens I've spoken to about the program, they like it, they want it, they need it, they're waiting on it. But it's not a priority. This is, because this is on the agenda for us to act on and spend money on. My proposal on officer residency program isn't. It should be a priority. I talked to 13 Houston police officers. 10 of the 13 I've talked to, they're waiting on it. They'd like to see it implemented. And it's a simple program, not the complex program that was presented at the committee meeting. So I'm opposed because this is one more example of how we're not focusing on core services. Changing the name of a department at this time and spending $50,000 to do that. It goes back to what Councilman Costello was talking about earlier. I do support giving the employees money to try to adequately compensate them in these tight fiscal times. I do support that. Do we need to be doing this in this tight fiscal time? This could be one employee's salary right here. This could be one employee in that health department, Dr. Kristen. But we're choosing to change the name on the building versus saving the $50,000. So I'm opposed to it because there are other priorities that I think we should be focusing on at this point in time. $50,000. I'd like to see that $10,000 per officer, 5 officers living inside the city of Houston in the proposed officer residency incentive program. Thank you.
Mayor Pro Tem Gonzalez?
Thank you, Mayor. Councilor Bradford, I do support the residency program, but to the item in chief, just want to be clear, maybe I'm incorrect, but this is not general fund, it's grant funded, it's the 1115 waiver program, so that's what's being used for this, not general funds. As you stated, it is $50,000 over the next 2 years, and based on your case studies and working with the community, the HDHHS brand just wasn't very effective in their mind. They worked with the community to identify a better branding model, and the new logo design itself will just be $3,000, and the implementation will be transitioned in only as new signage is needed. When the buildings are refreshed, then that's when they'll have the new signage. It's not going to be an initial cost up front. And Dental Harbor in District 8 was one of the pilot sites to see how this could work, but it's not general fund, to my knowledge.
Correct, Councilmember Stover.
And that's what I'm looking at here. It says the estimated cost of the name conversion is $50,000 over the next 2 years, and will be funded by the 1115 waiver. But then is the 1115 waiver, where is that funding from? I want to make sure that I'm clear on that, because if it's a pass-through or if it's something that's coming from any source within the city that wouldn't be available to the police or public safety, then I definitely would be voting no for sure.
These are federal dollars, and we are using, as I recall, 1115 waiver dollars for the EPIN program in the fire department. So yes, we do not police dollars, these are health-related dollars only.
Are they restricted
To health issues, yes.
so that they could not be used for what my colleague is suggesting?
No.
And it's over a 2-year period, so it's at 20,
Yes, ma'am. And the 50,000, it's up to $50,000, and really, it's, they're capturing the cost of printing new materials and so forth, but they're not gonna print them until they run out of the ones they have. So we're trying to give you the broadest.
and I appreciate my colleague's comments about, we've all been around long enough, or most of us have, that we know that, depending on what year you were in, where the inspectors were housed for Department of Neighborhoods and back and forth. And so I appreciate the intent of renaming and branding, but I caution the departments going forward that this is not something that we should be prioritizing, that we need to stay focused on the needs of the city. Thank you.
Councilmember Brown.
Thank you. And I like reading through the data when I have time, and I don't always have time to read through all of the data, but I try to look at some of it some of the time. And most people know when it is right, and some people will acknowledge when it is right, but usually all will suffer when it's wrong. See, when I looked at the data, the backup material the last time, it indicated general fund. Now, the data that we were given this week has an RCA, and it doesn't indicate a funding source at all. So take a look at it. There's no funding source attached to this particular RCA. This funding source is not applicable, and when you go down, none of the boxes are Xed. Now, that's what I received back on August the 12th, when this item first became before the body. Now, notice what is being referred to about the 1115 waiver. That popped up in a memo dated August the 20th, which we did not have, was not in the record on August the 12th as a funding source. So I don't know where it's going to be funded from. Because when you look at the official document that's in the record, the RCA, I don't see where it says in this document. I'm going to yield so somebody can point it out to me. Go to the record, which is the RCA. It doesn't indicate that it's 1115 waiver funding. If it's there, someone please point that out to me. It's not there, so we can look all day. So I don't know where it's going to be funded. All I know is that the information I received, I saw previously, it was general fund. So if it's not that, I still maintain that we ought to be focusing on core services and public safety is number one, and we need to move forward with that officer incentive program to get also lived inside of the city of Houston. So the ancillary letter, it is not controlling when I have an RCA in front of me. I'm not saying it's incorrect. I'm not saying it's disingenuous. I'm not saying that at all. I don't make those type of assertions. I'm simply saying that in the record, the RCA doesn't say that. Thank you.
Councilmember, you are correct. It was not in the initial RCA. When the item was tagged, we provided additional information via memo on August 20th. But no, it was not in the original information. Councilmember Starling.
Thank you, Mayor. This is the reason that I asked in my budget amendments that we add the matrix on each of these that shows the funding source. I want to give credit to the departments that have done so, and that we don't have to go to this extra work to look for the funding sources, or whether it creates more confusion in the process. I think it could have been a straight up or down in the past week if we'd known in the beginning. So if the agenda director would help us in the future in ensuring that matrix, that other departments, it's our best practice to include those matrices that are at the bottom that we've added in recently, that's included in all of them, so that we don't have to go through this in the future. It should be very transparent in the funding sources so that we understand what we're giving up in the process of voting for something else. Good intentions, unintended consequences. So I think this is something that we definitely has highlighted the need for this.